lot of my patients are afraid of the dentist. I want to talk about some specific ways to help you manage that dental anxiety. And stay tuned till the end of the video where I'm going to talk about some specific types of medications and sedation that can be used to help you feel more comfortable when you're getting your dental work done. Distraction is an awesome technique to use in the dental office. I always tell my patients to bring some headphones with them so they can listen to some music that is relaxing to them. I've also found that it's great to have the TV on. It helps a lot with my kid patients that don't like the sound of the drill. I have also had a lot of adult patients bring stress balls to squeeze or the fidget spinners. I've even had a patient before bring slime that they were playing with in their hand, just anything to distract you from what's going on inside your mouth. If you've never tried this before, I recommend give it a shot. It definitely can't hurt. Another medication-free solution you can try is essential oils. I actually have a lot of patients that use lavender before their appointments. They either put it on their wrists or underneath their nose, and it's believed that lavender can have a calming effect. I'm actually kind of surprised how many of my patients do this. Have you guys ever tried this before? If so, let me know in the comment section down below. Third option is meditation or breathing exercises. A lot of people do meditation to help with anxiety and stress. So maybe when you're sitting in the parking lot, you're in the car before going inside, or maybe you're in the waiting room, just take a couple minutes and do a little bit of meditation to help you feel more calm. Controlled breathing exercises such as 4-7-8 breathing or box breathing has also been shown to help a lot and make people just feel more centered. If you guys are interested in learning how to do meditation or do controlled breathing, I'm going to leave some links down below with some YouTube videos that can show you how to do it. Now, what if these medication-free solutions are not working for you? What if you have more severe dental anxiety? There are a couple different sedation options that your dentist may recommend. One option would be nitrous oxide, or commonly known as laughing gas. This is a type of minimal sedation that is done by having you breathe nitrous oxide and oxygen through your nose. You will be awake during the procedure. You still have control over your body. You're just gonna feel overall more calm. The nice thing about nitrous is that it wears off relatively quickly. So after your procedure, when you're leaving the office, you're gonna feel normal and there really aren't any residual effects. Nitrous can be used for both children and adults, and I've had a lot of success using it for many different procedures. Another option is oral sedation, which is taken via a pill. One common example of this that you probably have heard of is Valium. Typically, it's taken 1 hour before the dental procedure. It's going to make you feel drowsy and a little bit more relaxed. However, you will still be awake during the procedure, just like with nitrous. You will need someone to drive you to and from your appointment. I think that this is a great option sometimes to add if you're doing a more invasive procedure, such as a surgical extraction or a root canal or maybe an implant. A more heavy type of sedation would be IV sedation. This is where medication is given through a vein in your arm, so it acts very quickly. With this type of method, you are going to be in a semi-awake or twilight sleep, and typically patients have very little to no memory of the procedure. You will be able to breathe on your own, but your vitals are going to be closely monitored. Afterwards, patients typically feel groggy. Sometimes they complain of having headaches or being nauseous. Again, you will need someone to drive you to and from your dental appointment. The final sedation I want to talk about is general anesthesia, or GA. This is deep sedation. With this type of medication, you are going to be in a deep sleep and are not easily awakened. This is typically used for more invasive procedures, such as jaw surgery or for patients with special needs. When I was in residency, we saw a lot of patients with special needs that were not able to cooperate in any way. So we would actually take them to an operating room, put them to sleep under general anesthesia, and do all of their dental treatment while they were asleep. Sometimes we would be there for 4 or 5 hours doing all of their work. We also commonly did this with very small children. Sometimes we have children come in that are 2 or 3 and they have just rampant caries everywhere. So we would take them again to the operating room and put them to sleep to do all their dental treatment. While GA is recommended for certain cases, it should be noted that it does come with some risks. Under GA, you are not able to breathe on your own, and thus intubation is required, meaning a tube is actually inserted, usually through your mouth, sometimes through the nose, to help control your breathing. During this procedure, an anesthesiologist also needs to be present to monitor you the entire time. What form of sedation is best for you really depends on the type of procedure and also your medical history, so it's important to discuss your options with your dentist. So if you have dental phobia or have had a bad experience in the past, let your dentist know. Typically, managing dental anxiety is going to involve a combination of techniques. So your dentist can help you find what solutions work best for you. Many times people with dental anxiety just end up avoiding the dentist altogether, and this makes it a lot harder later on down the road when you need a bunch of treatment. So I really encourage you guys to have an honest and open conversation with your dentist so you can keep your mouth healthy. I really hope this helps some of you with dental anxiety. If you guys have any other methods that you've used, please share them with everyone down below or leave any questions. Thank you guys so much for watching, and I'll catch you for the next one.